Good morning, good afternoon, and good evening, everyone, from wherever you're joining us, and welcome to today's webinar titled S Stands for Systematic, Demystifying the Systematic Literature Review. Today, our speakers will present an overview of systematic literature reviews, detailing their purpose, execution, and decision-making criteria, and suitability for addressing key questions in the pharmaceutical industry. I'm Sarah McFarland from the events team here at scientist.com, and I'm happy to be your host for today. I'd also like to thank the sponsor of today's event, Icon, for making this webinar possible. All right, and now without any further delay, I'm going to bring Rebecca on here. Hi, Rebecca, take it away whenever you're ready.
Thank you, Sarah. Thank you, everyone, for attending our engaging webinar today. We're thrilled to have you. We're really excited to have the chance to talk about the process for systematic literature reviews. We have two great speakers today from our global medical communications team. First, we have Corey Pfeifenberger. Corey is a senior scientific manager at Icon Global Medical Communications. He has more than 10 years of agency and consulting experience in both medical communications and medical affairs, and he's experienced in developing and executing systematic literature reviews across diverse needs from epidemiology, education, and regulatory submissions. Corey is also both CMPP certified and a member of ISMAP. Additionally, we have Maura Hudson today. Maura is a scientific lead at Icon GMC. She brings more than 25 years of experience in medical communications, both from academia and industry, and is very experienced as well in carrying out systematic literature reviews to support various client needs. Maura is also CMPP certified and a member of ISMAP. And with that, I'll pass it on to Corey.
All right, thanks so much, Rebecca, and thanks everybody for joining us today. I'm gonna move to the next slide here. So the goal for our webinar today is to provide a broad overview of SLRs, what they are, how you do them. So our agenda here, starting off with the basics, what is a systematic literature review, if you're not familiar, and when should you consider doing one? We'll spend the bulk of the webinar today talking about how to plan and execute SLRs, and then round it out with some common challenges and pitfalls, and then finally our closing thoughts. So we wanted to start it off by getting to know you a little bit in the audience. So we have a poll that should pop up on your screen. How familiar are you with SLRs? Your options here, I develop them regularly and I'm very familiar. Sometimes I develop them, but probably have knowledge gaps. I've never done an SLR, but I have general familiarity with what they are. I seldom work with SLRs. And finally, what is an SLR? So I'll give you about 20 seconds, let you guys pop your results in. If you're curious, over on the right-hand side in the polls tab, you can see the responses pop up live. Give it a second here. All right, so we have some good responses here for anyone keeping track. It looks like most people are about where I would have expected. Some pretty good familiarity with SLRs, including a handful of experts in the audience today. So that's great to hear. So we'll move the talk along. For those who are really familiar, the first couple slides might be a little bit on the basic end for you, but hopefully there'll be some pretty good content in here that'll be useful for everybody in the audience. So we'll start it off. What is an SLR and when should you consider one? So if you just go online, Google systematic literature review, you'll find a lot of definitions out there. They're all pretty similar. We have one from Cochrane on the slide here, which is one of the leading providers of SLRs. I won't read it word for word, but it's there for anyone who wants to read through their definition. To us, SLRs are defined by a few key criteria, and that's what's listed at the bottom of the slide here. So SLRs are obviously reviews of the literature or possibly other available resources. By definition, they're pre-planned. They require a protocol beforehand. They're designed to answer specific questions, so not vague, broad questions, but they are their best when you have very specific questions. They're meant to be comprehensive. The goal is to capture all relevant data. And they're performed by a team with some redundancy. So it's not something that one person could take care of by themselves, no matter how capable that person is. And so how do these differ from other literature analyses that you're probably familiar with? We have on this slide a comparison of some key criteria, SLRs compared with targeted literature reviews, which are sort of a notch below SLRs. And then there are many other review options. We just kind of bucket all the others into this other category here for simplicity. But the bottom line here is that SLRs are the most rigorous review option. And so SLRs, as I mentioned on the previous slide, they require a protocol beforehand. You may need a protocol for targeted literature reviews, probably not for other literature review options. They're performed by a team, as I mentioned. So usually you have at least 2 reviewers or analysts doing the screening and extractions, in addition to a third member who's a manager and provides some oversight. Targeted literature reviews, probably a smaller team, and then other literature reviews, maybe just one person doing it themselves. They're also comprehensive. TLRs and others might be, but may not be. They require you to keep track of your selection choices. So why are you including or excluding articles that you've captured in your search? You might do that for your TLR, maybe not for other literature review options. For SLRs, you're going to create a database of extracted data. Might do that for TLRs, maybe not for other literature review options. And they require very specific reporting criteria, including reporting tables of your study and patient characteristics. Might do that for TLRs, maybe not for other literature review options. So ultimately, SLRs, really the most rigorous review option. And so when should you consider doing one? And so if you have a question, you're first going to need to decide if you can answer that question with data that's available publicly in the literature, or if you're going to need to do new data generation. And if you can answer that question with data that exists, you're probably going to want to do that, both because it's faster and a little bit cheaper. And so assuming you have the option to answer your question with published or publicly available data, the choice is then SLR or any other number of less rigorous approaches. So SLRs really are the best option overall, but they are almost certainly your choice if you need that high level of rigor. So if you want to use it for regulatory filing, or you want to have a publication that is systematic, you'll of course want to do an SLR. They're also really good in situations where you maybe have some concerns about the most easily identifiable or perhaps the most famous publications, concerns that they may not be representative. You'll want to have a comprehensive search so that you can provide some backing into why those famous articles perhaps aren't representative. They're also really useful in situations where you're trying to collect data that's pretty hard to find. So things that don't pop up in the title or the abstract and are not searchable or indexed, you'll want to take a deep dive with something like a systematic review. Now, all that said, you don't always have to do an SLR. There are definitely other goals you may have that can be addressed with less rigorous options. So, for example, if you just want to pull some information together for internal education purposes, or if you're interested in pulling together a narrative review, or just practically speaking, if your funds are limited, you may want to find some ways to get the answer you need with a little bit less rigmarole. And you'll have to just make those decisions on your own based on what you have available to you. All right. And so once you've made a decision to proceed and do an SLR, how do you plan and execute them? So this is going to be the bulk of the presentation today, and we're going to walk through the SLR development steps based around a few different cases, just to bring a little life and provide some examples for each of the steps. So we have three that we're going to revisit today. These are based on actual work we've done, but we've kind of changed some of the key elements of it just to retain some anonymity. So we have our first case, which is going to be a review of patient-reported outcome for patients with psoriasis. Our second case is an epidemiology review that was meant to support regulatory filing. And then our third is a little bit broader landscape analysis, supported regulatory filing, some internal education based on randomized controlled trial data. And so SLRs are a somewhat long process. There are several steps, and we're going to follow this winding road through our presentation today, starting off with the initial planning and protocol development, and then we'll slowly work our way through the search, screening, extraction, analysis, and finally the report steps that round it out. And so we'll start off with your initial planning and protocol development. So the very first step is you're probably going to want to pull together a team that's going to help you pull this review together and answer the questions that you set out to address. We have multiple contributors. So first of all, a project lead, which is probably going to be you if you're spearheading this endeavor. You're also going to want to work with your key stakeholders. So these are the folks behind the scenes who are driving the questions. They are the ones who ultimately have the need involved. And so that may be from your regulatory team or medical affairs or whoever is driving this question from your group. You may want to involve a subject matter expert, so somebody who can provide some general guidance and give some criticism based on your strategy and findings, keep you level set. If you're planning on doing any kind of statistical analyses or a meta-analysis where you're bringing data together from combining it from multiple publications, you want to bring in a statistician. It may also be helpful to work with a librarian to help provide guidance on your search strategy. And then finally, you're going to have your on-the-ground team, the folks who are actually doing the screening and extractions. This will be at least a 3-person team. You'll have 2 reviewers or analysts, depending on what terminology you want to use, and then 1 manager who can provide arbitration for those 2 reviewers. And I should say that 1 person can fulfill multiple roles on this slide. So, your subject matter expert may also be one of your key stakeholders, but these are generally good groups to involve. All right, and so once you have your team together, you're going to want to clearly state what question it is that you want to address with this project. And so we have an example on the slide, a pretty simple question here. How long do patients with lung cancer live? And I think that's a pretty basic question. It's the kind of thing you would probably start off with at square one, but it is a little bit problematic in its simplicity. And so it kind of raises some follow-up questions. What type of lung cancer do you want to focus on? There's many different kinds. Do you want to focus on a specific geographic region, just Europe or United States, or is this worldwide? Are there specific treatments that those patients should have received? Any age group or time frame? Is this real world or clinical trial data? And so really at every step, we want to make sure we're as clear as possible about what we're trying to address with this review. And so we can update that question and make something a little bit more specific. So down at the bottom of the slide, we have a more specific example. What are real world median overall survival rates for adults with non-small cell lung cancer in the United States who were treated with approved biologics as first-line treatment between 2015 and present? And so we can take a very simple question and really put some good constraints on it. So that way we can manage the scope of this review and really get the data that are most important for our stakeholders. And so if we apply this to the cases that we set out a few slides ago, our first case, we have a main question: what is the evidence for quality of life burden in patients with psoriasis? And well, wait a second, that's a pretty vague question itself. And so we can have a really complicated main question, or we can have some clarifying sub-questions, and that's kind of what we did here. So how was quality of life assessed? What tools were used? How was it affected by patient characteristics? So on and so forth. For case 3, we might have a main question of what are the comparative efficacies of antibiotics for cellulitis? And then we can provide some constraints or defining criteria in sub-questions. And these are all very helpful, but obviously there's still a lot left unsaid here that should be clarified before we wanted to really start our analysis. And so defining your question is really step 1 in creating a protocol. And as I mentioned before, SLRs as a defining characteristic require a pre-planned protocol. And the goal here, really most importantly in blue, is we want to establish our methods before we do the search. And this is meant to minimize potential bias. That way you're not reacting as you're seeing the results come in. You define what you're setting out to do and the question you're asking and how you're going to do it. And the results are what they are. You get your answer. You aren't affected by it. It's also important because it can help clarify the requirements that you're going to need to address your main question. And the protocol also can be used to set specific constraints to the main question so you can narrow your focus. This is going to help you manage scope. You'll be able to do it faster and hopefully cheaper. And so one of the first steps for clarifying these in a protocol is a PICO table. This is a grid that helps define your patient population, any interventions or comparator treatments, and the outcomes that you want to look at. These are really great for any SLR you want to do on randomized controlled trial data, but they're still very useful for pretty much any SLR that involves patient populations. And so if we apply this to a couple of our cases, we have case 2. This was a pancreatic cancer epidemiology review. Our patient population, of course, patients had to be diagnosed with pancreatic cancer. We were pretty flexible on age, but geographic region, we wanted just patients in the United States. These patients could be treated with any intervention, and we were looking for incidence, prevalence, and survival. For case 3, a little bit different scenario, but same idea. These were patients that were diagnosed with cellulitis. They had to be adults, but they could be from any geographic region. They, of course, had to be treated with an antibiotic, active control as a comparator, and outcome, some kind of cure. And we had some more specificity in the actual analysis, but for simplicity here, we'll just say a cure. And so that's all good information, but still there are a lot of unknowns here that we would want to define. And so first of all, what types of studies would we want to include in this analysis? Are we focused on clinical trial data, real world data? Are these observational or interventional studies? And if interventional, should there be an active comparator, a placebo? We also want to define what databases we're going to search. So there are many available search engines to search the medical literature, and they're all a little bit different in terms of what publications they house. And so it's a good rule of thumb to include 2 to 3 search engines if you can. So we have PubMed and Embase and Scopus here, which are pretty commonly used. You may also want to take a look at an SLR repository like Cochrane's library. First of all, just to see if someone has already done the review you're planning on doing, because you could save yourself some time. But also a similar SLR might have a good list of references that could serve as a first base. You'll want to consider if you want to search Congress abstract databases or other great literature like epidemiology registries, or maybe just Googling. You also want to clarify what kinds of data sources you're going to use, or do you need to use prospective studies? If you're using retrospective, are you okay with chart reviews, claims, databases, registries? And then just some other considerations. You'll want to define a time frame, not just for publication year, but also data years. So for example, did something happen in 2019 that You only want to look at data that came after that. And then language restrictions. Do you want to just stick to English or expand to any language? All right, and so if we apply these considerations to our cases, how does it play out? So we have case 2, again, our pancreatic cancer epidemiology review. For this, we wanted real-world data because we were doing an epi study, but otherwise we were pretty flexible. Data sources could be pretty much anything as long as it had epi data, medical charts, insurance claims. The databases that we searched, we chose PubMed, Embase, and Scopus to really cover the literature, and then also did some searches of SEER, which is the US Cancer Epidemiology Registry. We established some constraints for time frame and restricted to just English language publications. And then similarly for case 3, antibiotics for cellulitis. For this one, we just wanted to look at randomized controlled trials that had an active comparator. Again, search the common literature databases, and we're pretty flexible on time frame and language. And so with that, I'm going to hand it over to Moira, and she's going to take us through the rest of protocol development, searching, and extraction.
Okay, thank you, Corey. So now we're just going to take a look at how to develop search criteria using case number 3, the antibiotics for cellulitis, as an example. So the first thing you need to do is identify the key concepts of the research question. So for this example, where we want to look at skin infection and how we would treat them, we could select the anatomic location, as i.e. skin, the term cellulitis, and then to retrieve publications that deal with bacterial infection, you could choose the term antibiotic. So could you advance the slide, please? Thank you. This is where, so next you need to derive the search terms from the concepts. This is where you should involve a librarian, if you have one, and any other members of your team. Everyone has different ideas and can bring different thoughts to the table. Your search terms can be the concepts themselves, they can be synonyms or alternate words, and they can be short phrases. A good place to start is by identifying any key papers that need to be picked up by your SLR, and any SLRs and other reviews on the same or a similar topic. So look at these for additional relevant keywords, particularly in the methods section. And so for case 3, we've added infection to the cellulitis concept, skin structure to the skin concept, and antimicrobial to the antibiotic concept. Next slide, please. So now you have some of your search terms, it's time to test them by running a basic preliminary search. So you can use Boolean operators to combine the search terms. You can use OR to combine similar terms and synonyms. And then you can use AND to combine the categories. So a couple of things to be aware of are that authors don't always consider medical subject heading terms when preparing their manuscripts for publication. So if you're using these, do combine them with text words for a more comprehensive search. Don't be afraid of including outdated terminology, if appropriate, because earlier publications may use them, and you'll see an example of that later on. Then run a preliminary search in one database, and good places to start are Embase or PubMed. So let's now take a look at what a preliminary search string may look like. So in each box across the top here, we have the text words and the mesh search terms combined with OR, and then to find the relevant hits, those groups are combined with AND. You'll see that we've added an additional group at the end there, combined with OR, to define the study population, because we want to look at adults, we don't want to look at children. Some of you will have already spotted that there are some potential issues with these terms. For example, the term infection may be too broad. It may pull in too many hits for you to screen efficiently. Skin may not be the clinical term always used in a publication, so you can consider adding terms such as subcutaneous. And for the treatment groups, studies, titles, keywords, they'll use the names of specific microbials, antimicrobials, rather than the broader term. So there you will know from your background reading what antibiotics you want to put in there. And there would be many more in a so-called proper search, but this is an example, so we've just selected a few there. And for the last group, for the study subjects, and again, this is where older publications may use outdated terms for adults, like geriatric or elderly. So modifying the search terms, as shown in the next slide, will improve the accuracy of your search and decrease the noise. And note that we've added some additional relevant search terms to the infection category. We've added the names of the antibiotics, and we've added some additional synonyms to the study population. You can also make use of the Boolean operator not to allow you to exclude certain studies. For example, here we've used it to exclude pediatric studies. So at the very end of this process, look at the hits retrieved, and there's a number of questions you can ask yourself. First of all, do you get enough hits? You know what the size of the literature from your previous reading and from any previous reviews, so you should have a rough idea of whether you're getting enough hits. You may feel you're getting too many hits. You may be pulling in a lot of inappropriate publications that you really don't want to look at any further. And you really need to ensure that the key papers that you discovered at the very outset, you need to be sure that those are being picked up. If necessary, then you need to adjust the search terms and retest. When you're happy with your search string, you need to translate it for use in the other databases that you plan to search. And there's numerous tools available for this. There's something called Polyglot to translate PubMed search to other databases. And Cornell University and King's College London also offer some tools. Or you can do it manually. And in addition to doing all these things, hand search the reference lists of your key publications, because that may, by a process of pearl growing, allow you to find additional articles to include. So you have your search string. What next? Well, before you start screening and extracting data, consider registering your protocol with Prospero. That's the International Prospective Register of Systematic Reviews. Importantly, if you're planning to publish your SLR, bear in mind that many journals require registration with Prospero in order for them to consider your manuscript for publication. So we're next going to take a look at how you get from your literature search to the data you need to create your SLR report, the steps of screening and data extraction. Before you start screening and extracting data, think ahead to the deliverables you plan to create. Clearly defining expectations of your clients, yourself, your team at the outset can avoid issues later on. For instance, you'll want to think about what content you'll need, what format to follow. If a template isn't available, plan how to format and style the report, as this may impact how you set up the data extraction. Bear in mind that extracting data is time hungry, so aim to extract the necessary data to answer the research question. A further consideration is that publication invariably requires you to follow PRISMA guidelines. We have the next slide, please. This is a 27-item checklist of things that must be reported in a systematic review, from the fine details of methods used to registration of the protocol and what to include in the discussion section. So be sure to download and use these checklists and guidelines, and they are free. Okay, so now you have your protocol, and you go ahead and carry out your database-specific searches. Then what do you do? What do you do with the list of hits? So if at all possible, and if your budget allows it, use SLR software. And on the left there, there's a number of these listed. That's not an exhaustive list, but there are a number of these available. They come at different costs and with different levels of support. The advantages of these systems include that they have built-in processes for tracking your decision-making. For example, whether you decide to include or exclude a publication. And they make record keeping a lot simpler as they house all of the steps of an SLR in one piece of software. However, if you don't have budget available to purchase software, or you don't have access to such software, you can use the tools that you already have, such as EndNote, Mendeley, and Excel. So this is the searching and screening process, and this consists ordinarily of 2 steps. Each step needs to be carried out by a team consisting of at least 3 people, 2 to do the screening and 1 to oversee the process and provide guidance and any arbitration if needed. An initial screen of the title and abstract will allow you to include or exclude many of your hits, just based on that small amount of information. Once you've excluded things that you're sure you don't want to include, then you work with the list of unexcluded texts and take a deeper dive into the content of each hit. And that will allow you to refine your list and select those papers that truly address the question that you posed in the beginning. Very important in this step to document the reasons for exclusion at both steps, because things may get excluded only at the full text review in some cases. For some sources, like Congress abstracts, you can probably combine the two steps where you've not got very much text to look at. However, before you get started, there are a few things that you need to do. You ensure that you have the full text of all the articles included. That sounds really simple, but the last thing you need is to find that you don't have some text when you get to the end of your data extracting process. Agree with your review team which pieces of data you need to collect. Make sure everybody is clear on what they are collecting, because some things can be open to interpretation. You need to train your team and create pilot data collection tables and test them on a small number of publications. And then you can refine it if necessary before you go head on and start extracting all of the papers. And keep in mind the data summary tables that you'll need for your final report or for a manuscript if you're planning to publish one, because being smart now may allow you to repurpose things and save time later. Extraction will require at least 2 data extractors and an overseer to resolve discrepancies or uncertainties. And as I've already said, take time to train your team. Can save you a lot of time in the long run. And it's obvious, but be careful to transcribe data accurately and keep track of where each piece of data comes from in case somebody queries it. And finally, proofread your data to ensure accuracy. Just a few things to bear in mind during data extraction. Extraction templates and approaches are specific to the SLR needs. They will vary. Extraction is time consuming, and this I can't stress enough. Only extract what is needed to answer the research question, because you are going to be swamped by all kinds of what you may think is really interesting or really relevant information. Keep focused. Ideally, in an ideal world, you should want to rely only on the extraction database moving forward. You shouldn't need to take recourse to the source publication. So for case 3, let's take a look at the sorts of data you may need to extract. So case 3 was, what are the comparative efficacies of antibiotics for cellulitis? So first of all, the source. Where did these data come from? Include the unique identifier of the study, such as the NCT number, the study name or the acronym if they have one, and also the full citation details. And another important thing here is always record who extracted the data. for each record. For the methods, you'll want to report what kind of study it is. In our case, we're only interested in RTCs, but you may have an SLR that requires you to use other sources of information. You want to know, if it's an RTC, how the patients were randomized and how long was the study. Was it a 1-month study or was it a 12-month study? Then moving on to participant details, you want to record how large is the study and who are the participants. We need to know both the total number of patients included and the numbers in each intervention group. And depending on your research question, you may need to note any demographic or clinical characteristics that may have a bearing on treatment efficacy. For interventions, you need to consider total intervention groups, for example, study and comparator antibiotics and doses, the routes of administration, and the times taken to administer. It's all details that you may need. And for outcomes, for each outcome of interest, record the outcome definition. For example, in our case, the proportion of patients with a microbiological cure, and also the results of the outcomes. At the bottom, we've got the miscellaneous category. And things that you might want to consider putting in here is if there was a sponsor for the study, such as a pharma company, because that may affect when you're evaluating bias. And you could also consider including here the author's key conclusions and references to other studies. For instance, this might be an open label extension of an earlier randomized controlled trial. So you want to reference that RCT. Also, you might want to make a note of any interim analyses that may have been released already as a conference presentation. So I'm now going to hand it back to Corey to discuss critical appraisal of the results. Over to you, Corey.
All right, thanks, Moira. All right, so we've gone through our screening, our selection and extraction process, and you're probably ramping up ready to start analyzing the data, but you'll probably want to take a stop before that and take a moment to really consider the quality of the publications that you've selected. So regardless of how a publication is done, there are always going to be some potential sources of bias or quality concerns, maybe from the study design or how the study was conducted, the quality of the underlying data source, or just how the methods or the data were reported in the publication. Was it thorough enough? And so what we're going to want is a simple way to compare the quality and bias of the articles in a very straightforward manner. And fortunately, there are a lot of really great tools specifically designed for this that are widely used. There are critical appraisal tools from Cochrane that are great for randomized controlled trials. There's the Newcastle Ottawa scale, which you'll see used a lot for non-randomized studies. And then University of Oxford, JBI, Casball have long lists of critical appraisal tools that are specifically designed for specific study types. And the beauty of these tools is that they can output basically a single number. So you can very quickly compare the quality of your studies to one another. And this is what the critical appraisal step is all about. And so on the right, we have an example from JBI. This is their checklist for prevalence studies. You'll see it's just a list of 9 pretty simple questions, and then yes, no, unclear as responses. And so the first step, of course, is you're going to want to choose a tool. And, you know, if the ultimate recipient of your SL report requires one, well, that's the one you're going to use. But otherwise, these are all, as far as I'm aware, freely available. So our recommendation is to go pull down a few of them, try them out with your team in a pilot test, see which ones work best for your study. And then sort of get to it. So your appraisal process is going to be pretty similar to the screening and extractions. It's a 3-person team again. So you're going to have 2 people doing the grading and then a manager providing some oversight and arbitrating and helping decide if there are discrepancies. The most important thing to consider beforehand is really making sure everyone on the team is aligned on how you're interpreting and answering these questions, what criteria they should use. They are deceptively simple, but they're highly subjective. So if we zoom in and just take question 4 as an example here from our prevalence checklist, Were the study subjects and the setting described in detail? That's a really great question and one that's important to answer, but it's incredibly subjective. So you'll just want to meet with your team beforehand, make sure everyone is on the same page about what it means to say yes to that question. And so as an example, in case 2, we required that the studies reported the median age, sex of the patients, race, and geographic region. And that was kind of good enough for that analysis, but that may not be enough for your analysis. So it's something you'll just need to come to an agreement with for your team. And so ultimately, you'll do the critical appraisal and you'll get a single number, and that will help grade the publications in a way that's easily comparable. All right, and so we've talked about the screening steps, extraction, we've done an appraisal. We now get to the fun bit, and this is the analysis and the report at the end. This is where you really get hopefully a clear answer to the question you set out to address. And so we'll start with the synthesis step. We just have one slide on this. For anyone who's uninitiated, the term synthesis is very confusing, but it's really just the analysis step, if you want to think about it like that. This is where you bring everything together. It's where you're going to take your extraction database, all that data that's sitting there, and really start pulling it together to develop your graphs and tables, whatever statistical analyses that you'd like to do, your meta-analysis if you're planning one, and any narrative descriptions, whatever it takes to take that database and turn it into a clear answer to address the questions that you set out to make. And you'll probably come out with some really nice looking graphs like we have here. And then somewhat in parallel with that, you're going to start pulling together your final report and really summarize your findings. The format this takes is really going to depend on who you're handing this report to. They may have specific requirements, or if you're publishing it, it's going to have to follow PRISMA guidelines and journal guidelines. But for the most part, there are a few different sections you're almost always going to have, and we list them out here. Some of these are pretty obvious, but I think it helps to just kind of spell it out. So you'll of course want to have some kind of introduction, talking about why the analysis was important to do, and providing some background so readers can step in and kind of have some firm footing to interpret the results and understand why they're reading it and how the data address the question. You'll also want to have a detailed method section, and hey, you spent that time in the beginning developing a protocol, so that's mostly done for you. You can kind of carry that into your report. You're also going to want to have a selection flow chart, or a PRISMA flow chart, and this is a diagram that shows the number of hits you found from your screen. It details your selection steps, so which article or how many articles you included and excluded, why you excluded those articles, and then ultimately how many are included in the report. And this is really where SLR software comes in handy. It takes care of this, tracking this for you, so you don't need to worry about it. It just kind of spits it out at the end. But if you're doing it with Excel and EndNote, going old school, you're just going to be very careful about keeping track of why you made the selection steps you did. Just save yourself some time and your sanity at the end. There, of course, could be a lot of tables, figures, but most importantly, you're going to want to have some overview summary of your study characteristics and patient characteristics from all the selected studies that you've included. We have an abridged example at the bottom of the slide, but you can see here study design, data source, study period, some important characteristics, just so any reader can step in and have a good idea of what kind of studies were included and how they kind of compare to each other. You'll of course want to have a detailed results section, all your key findings that direct toward the answer of your initial question, and then some kind of closing discussion that brings it together, highlights any gaps or insights you may have pulled out, and maybe an executive summary that gives quick answers right at the top of the document. All right, and so that takes us through our windy road. We've gone from planning the SLR right through the report. We wanted to finish things out just talking about a few challenges and pitfalls that you might encounter if you're doing one of these. So the first is expanding cost. These things are more affordable than new data generation, but as I'm hoping you can get a sense from the webinar today, there are a lot of steps, there are a lot of people involved, and it tends to be a big undertaking. So they tend to be a little bit on the expensive side, and they have a tendency to grow in size as they go. You end up finding there's more out there in the literature than you expected. People on your team have follow-up questions. So there is a natural tendency for these to grow. So a couple of things you can do to kind of rein it in and keep them focused. First of all, keep your questions as focused and as simple as possible. You want to make sure that you're answering a question that's addressable and one that doesn't require a lot of extra searching. And related to that, make sure you design your search criteria in a way that are restrictive as possible. You want to stay focused and hopefully manage the scope that way. In the upper right, when you're first planning your SLR project out, really take time to consider what level of detail you actually need to answer your question. It's really fulfilling to get a lot of granular data, but sometimes that's totally unnecessary. So it's good to remain focused whenever you can. And then even at the beginning, think about what you actually need in your report at the end. Maybe you need a 200-page report, and that's great. That's what you'll get. But maybe you can make do with something a little bit shorter, an abridged report or a short slide deck. Just whatever your needs may be, you may be able to save some time and money just by keeping things a little bit simpler. So the second challenge is how to address the ever-evolving literature. Publishing never ends. You're going to do your search, and the next day there are going to be totally new hits popping up. And you're going to want to think about that beforehand and how you want to address that scenario. So are you going to have a hard cutoff where you do your search and nothing after that date matters? You're not even going to consider it. Are you going to keep it open-ended, or you're kind of continuously bringing new things in? Probably want to avoid that just for your sanity, but maybe you want to keep it live. But maybe there's an in-between option where you're just going to pull in any highly relevant data that may pop up after the initial search. But you're going to want to be careful and really be clear about how you're defining that. So the third challenge is how do you address insufficient or unexpected results? You do your analysis and either the data available don't really answer your question, or even worse, they don't give you the right answer that you needed. So what are you going to do next? You can expand your search, remove some of the constraints that you had initially to see if there's anything you missed that might be useful. You can consider using proxy data to address your question. So maybe you sought out to get overall survival, but maybe progression-free survival is good enough. Maybe you can calculate what you need from what you found. If you have incidence and survival, you can calculate out prevalence. Also, what I consider maybe redefining how you define high quality data. It's a gray area, walk a fine line, but maybe you can adjust where you set your threshold for your critical appraisal inclusion. And finally, maybe the answer is the answer, and you're willing to accept that when you go into it. If it doesn't address the question or it gives you whatever answer it is, you'll live with that and kind of move to the next thing after that, maybe new data generation. And then the final challenge is bookkeeping. There is a lot to keep track of in an SLR. You have a search strategy, you have your initial results, you've made selection choices and you have reasons for those choices. You extracted a ton of data. You analyze that data. There's underlying logic behind it all. There is a lot to keep track of at every step. And so this, again, we talked about it before, but this is where SLR software can be useful. There are a lot of options. It's really great at just keeping track of all these steps, keeping everything in one place. It saves the user a lot of effort. And then just in general, just use good labeling and organization. When you're in the mix, it seems like you're going to remember why you did something a week from now, but you will not. So it's just good to keep track of why you're doing the things you're doing and keeping everything organized so you can find it later and somebody else can find it if you happen to disappear. And so we'll round it out. This is our last slide for our presentation. Some critical considerations for how to succeed. So just as a reminder, SLRs are the most rigorous review option, but they're not always the right fit. We didn't really talk too much about the other options, but under the right circumstances, you may be fine using something a little bit less rigorous, like for internal education or narrative reviews. But if you need that level of rigor, SLRs are definitely the way to go. You want to keep your questions as focused and as specific as possible to manage scope. Plan ahead at every step. So really take the time to discuss the project with your key stakeholders, come up with effective search criteria, and make sure your expectations are clear for your deliverables, and try to avoid those pitfalls that we went over on the preceding slides. Make sure you and your team are very familiar with the tools and the software you're using, so have alignment beforehand. And most importantly, just stay organized and have good record keeping. And you should have some success. And so with that, thank you for your attention and happy to take any questions that you guys may have.
Thank you both, Corey and Maura. We have had several questions coming in about timelines and kind of what's the typical or expected timeline for an SLR. Can you clarify that a little bit?
Yeah, these are long undertakings. So definitely on the scale of months. So each of those steps, like developing a protocol, doing the search, the extraction, each one is weeks. So usually a few months, but they can go longer. It depends on the volume and how many review steps, how much go between there is between you and your stakeholders, but usually a few months. I don't know, Moira, does that align with what you've done?
And they always take longer than you think they're going to take as well.
Yeah.
Yeah.
So I think the other question that kind of has fallen out and has come up a few times as well, but aligns with kind of that timeline is what's the ballpark budget for an SLR? And I'm sure this varies. Again, we've talked about questions vary and resources. Do you have kind of I'm not sure if we really can clarify that or.
Yeah, it depends on the scope. I mean, I've seen them, 80 to 100, but it depends. They can get bigger, they can be smaller. A lot of it depends on how much you want to refine the search and what your expectations are. So that's kind of got into that a little bit. But if you can keep your question simple and your search very focused and maybe your deliverable a little bit more abridged, you're going to save a lot of cost. But if you have a lot of needs, you maybe need to do a very broad analysis that's landscape analysis. It's the sky's sort of the limit. You can spend as much as you want to spend on them, I guess.
So I think another question, kind of shifting directions a little bit. Any tips and tricks for searching specifically for adverse events in an SLR?
Yeah, so looking for studies that have that data. It's a little bit tricky. There are some that are associated with a drug, and if you have that list beforehand, you can kind of search for it as part of your search criteria. But if you're worried about sort of capturing everything, or if you're worried about capturing adverse events that maybe don't pop up in the search string, so things that aren't indexed, it's one of those situations where you kind of have to cast a wide net. So you have to think about what kind of studies would have that data, and you sort of search for it based on that. So if these are adverse events you want to focus on just in a clinical trial setting, you can kind of search for just common, the clinical trials that are associated with that drug. But if you need real world data, then we have a long list of search terms, sort of boilerplate for how you identify real world studies that we've kind of slowly developed over time. So for me personally, if it had to be real world and you're looking at side effects from a drug, I'd search for the disease and then our laundry list of boilerplate terms for real world studies. And then it's a little bit more laborious, but if you're trying to get something that's not going to pop up and it's not indexed, I think that's kind of the only approach you can really take to make sure you get it, to get all the information you need on that. So casting a wide net, I guess, is the short answer.
Yep. Okay. Making sure that information is included when you're setting that process. Another question for the risks of bias evaluation. Do all studies in the SLR, those that meet your inclusion criteria, need to be evaluated, or only those that actually contribute data to the quantitative meta-analysis?
It's a bit of a judgment call. I mean, I think if you're including it in the analysis, then it should be done. So if it's past your selection criteria, then yeah, I would say do it. But ultimately, it's going to depend on what you're using your SLR for. If it's going to be published, I would say you're going to have to do them all. If it's more internal education purposes, you can kind of do what you want. You have a little bit more flexibility there. If it's a report where you have to focus on just a select number of articles, then I think you get away with just critically appraising those ones. But it's going to depend on the scenario, if I'm honest.
Okay. Laura, I see you nodding your head. Is that kind of where you?
Yeah, definitely. All of the ones that will be included in your report should be assessed. Some of the others, possibly not, because there may be a very obvious reason why you didn't include them. So then you wouldn't need to go through the minutiae of the exclusion list for those ones.
All right, great. I know we're getting tight on time. We have a few questions coming in about AI. So I'll kind of sum it up a little bit and then let you guys talk a little bit about that. But do you recommend using AI in the SLR process? And yeah, a few questions about have you used any tools, AI tools?
Yeah, AI it's so hot right now. Yeah, this is the perfect use for AI. I think there's obviously a lot of buzz for good reason. It's a big process thing, and it's trying to identify patterns. So it's perfect for this. I think it's like any other field. We're all kind of holding our breath, seeing to what extent it's going to live up to expectations. So we talked a little bit about SLR software. So the good ones that are out there, they already incorporate AI into it to help with the selection and screening process. So to that extent, we've used it for that purpose, and it's really helpful for that. I think in 5 years, it's going to be even better. The one thing I would caution is that I very much believe it's going to increase output. Like one person or a small team will be able to do more SLR work in a shorter amount of time with AI. But you're always going to need that human element. So you're always going to need eyes on the results and helping with the screening and interpretation of your SLR. I think we're a long way away from AI sort of running it on its own. Just asking Gemini to do your SLR for you is probably not going to happen anytime soon.
All right, great. I think we are at time, so I'm just going to, again, thank both Corey and Laura for being here and taking the time to speak to us today, and thank all of you for attending. If you have any additional questions, our contact information is all here. Please feel free to reach out to us. Happy to answer any further questions.
In closing, we hope that you enjoyed this HealthEconomics.com webinar sponsored by ICON, and I hope you enjoy the rest of your day.